All right. Good evening, everybody. I think my screen is visible and voice is also clear, right? Chalo. Let's begin our class with a small case. Today, let us try to learn some basic concepts about liver disease, and especially there is one condition. We will try to discuss about that condition. So, before understanding about that, let us first see the case. I think you might have already gone through the case. Let me read it once. See, a 54 years old woman, patient is a woman who is having 54 years, okay, and patient is having primary biliary cirrhosis. Patient is diagnosed with primary biliary cirrhosis, very very important condition in hepatic disease. We will try to discuss about this. Anyways, chalo dekho. A 54 years old woman who is having primary biliary cirrhosis has been complaining of increasing backache. Patient was having backache for over 3 months. Her general condition has deteriorated over the year during which she has suffered due to ascites and due to encephalopathy. Previously patient was having ascites, and along with that patient was also having encephalopathy. Due to these two conditions, patient's condition was already deteriorated, and right now, for the past 1 month, patient was having for the past 3 months patient was having backache. Okay, her main complaint of the continuous back pain which disturbs her sleep. Okay, see, simply the case is telling that patient is 54 years old woman, and patient was diagnosed with PBC, primary biliary cirrhosis. Okay, this is a autoimmune disease. I'll try to explain this. And for this condition, patient had ascites, and patient also had encephalopathy 1 year ago. Due to that, patient's condition is already deteriorated, and right now, since last 3 months, patient was having back pain. Okay, so this is the condition. Due to back pain, patient is unable to sleep. Clear? Now let us go to the question. Give the reason for the continuous back pain for this case, and give the management for this patient. I think this case is clear to you all. समझ गए ना सब लोग केस? You understood the case? Patient was female, patient was diagnosed with PBC, and due to PBC, patient had ascites, patient has encephalopathy in the past. Due to that, patient had to face many lethal consequences, and along with that, right now patient is facing back pain. Now, first question is, what is the reason for back pain, and what will be the treatment option for this patient, is the question. Now, let's try to understand this case. Before understanding about this case, first let us understand what is primary biliary cirrhosis. It is also called primary biliary cholangitis. Confused nahi hona. This primary biliary cirrhosis is also called primary biliary cholangitis. Okay, so before understanding about this condition, let me tell you some basic points. पहले basic points सीखेंगे. We'll go very fast. In previous classes already I think I have discussed. See, just imagine this is a liver. Okay, in liver we have gallbladder. Okay, see, liver has some very very important functions. First very important function of liver is storage. Storage of what? Liver is very important in storing especially vitamins and glycogen. These all things we already know. First important function of liver is it is important in storing vitamins and glycogen. Next, liver is important in maintaining homeostasis. Homeostasis. If patient has starving or if patient has hypoglycemia, immediately the stored glycogen will be converted into glucose. Okay, so through this it maintains homeostasis, and whenever vitamins are required or whenever proteins are required, everything will be maintained through liver only. So it maintains homeostasis, and it also maintains blood pressure. These all concepts we'll discuss later. Okay, the third important function is it is very very important in secreting. It secretes what? It secretes bile salts. These bile salts are containing cholesterol, and it also contains some excretory waste products like bilirubin and all other fatty substances. And these bile salts are very important in helping. It helps in digestion of fats. Okay, digestion of fats. Anyways, chalo. So it is important in secreting bile salts. This is another function. Next function क्या है? See, very 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 important function of liver, याद रख लो. It is important in excreting cholesterol. Very 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 important. what is the function of liver is it is important in excreting cholesterol. अपने body में जो cholesterol it synthesizes cholesterol and it excretes cholesterol, and the cholesterol what we take through external sources from the outer sources, that cholesterol is also excreted by liver only. So liver is important in excreting cholesterol. All these functions you will learn in clinical presentations, याद रख लो सब. Next very important function of liver, is it maintains or it helps in synthesizing. What? It helps in synthesizing particularly albumin. In previous classes about edema concept I explained you. Albumin is the plasma protein which is synthesized by liver, and along with this very very important clotting factors. Clotting factors are also synthesized by liver, and it has it also synthesizes vitamin D. याद रख लो, it synthesizes vitamin D. And another very very important function is it helps in metabolism. Metabolism of what? Metabolism of everything, starting from drugs, starting from hormones, everything, testosterone, estrogen, progesterone, drugs, paracetamol, everything, whatever we take, all these xenobiotics or all the drug substances which are not required for our body or which is in excess, everything will be metabolized by our liver. So these are some basic functions of liver. Okay, so to understand all these concepts related to liver, you should understand these basic things. Okay, these points already you know, I'm just revising. Now you see, you understood about the functions of liver, right? Now we will try to understand the primary biliary cirrhosis. So before understanding that, let me add some more important points. Let me add some more basic points. First, you should know what is do you know what is acute liver disease? Anybody from the class, what is acute liver disease and what is chronic liver disease? You should know this difference, because we are discussing about the liver disorder. You should know what is acute liver disease and what is chronic liver disease. Can anyone tell me the difference between these two? Anybody from the class? If you know, tell me yes, or else I'll continue, because we don't have time, already we started late. Listen, acute liver disease, always wherever acute comes, it is rapid onset. I mean, it comes rapidly, quickly, suddenly aa jata patient ko, condition whatever it is. Acute means condition comes suddenly. And acute liver disease is self limiting episode. याद रखो, it is a limiting self limiting episode. It is a self limiting episode. याद रख लो, this statement you should remember. It is a self limiting episode of hepatic cell damage. It is self limiting means it will be cured itself. Most of the cases, 90% of the cases, 90% exactly we can't say, most of the cases resolves spontaneously without any treatment. First point, see, first thing, all acute liver disease is self limiting episode and it destroys the cell of the hepatic tissues. 90% of them are resolved spontaneously. Okay, and next, see, if in some cases acute liver disease is very dangerous, in some conditions. Why? Because immediately patient requires liver transplantation. See, in acute diseases, in acute conditions, 90% of them will resolve themselves, but in some cases agar patient liver is not recovering quickly, we should go with liver transplantation. ये चीज याद रख लो, number 1. Okay, and see, liver transplantation is usually performed. Why? Because suddenly if anybody has acute liver injury, patient will have two complications, very very important complications of hepatic diseases. In that, first complication is hepatic encephalopathy. You might have heard about hepatic encephalopathy. This is a very different, it is a huge concept. I will explain this. Hepatic encephalopathy is one complication, and second complication is coagulation or coagulopathy bolte, coagulopathy. Here coagulation factors are not present and patient will have bleeding disorder. Acute liver disease में क्या होगा? Patient will have hepatic encephalopathy. Due to this, brain will be damaged and patient will have bleeding disorder, coagulopathy. So because of these two complications, acute liver disease immediately requires liver transplantation if patient has hepatic encephalopathy and coagulopathy due to acute liver disease. Okay, but mostly if they don't have these complications, 90% of them will be resolved. And for acute liver disease, there are so many causes. I'll explain those causes also now. And second one is chronic liver disease. Chronic liver disease is It is not seen rapidly. It is not. Liver diseases takes lot of time. Okay, and see, chronic liver diseases, they will persist, they will present in the body from 5 years to 25 years. They will not cause any damage, they will not cause any morbidity to the patient, but still chronic liver diseases will stay in the body for 5 to 25 years without any morbidity. Okay, so in these are chronic liver disease conditions. Now, what is chronic liver disease? You understood what is acute liver disease, a self-limiting episode of hepatic cell destruction. And chronic liver disease is not like acute kidney disease. Here, remember one thing: in chronic liver disease, permanent structural changes will be seen. Permanent structural changes will be seen in the cells or in the tissue. And these permanent changes in the tissues due to destruction or due to hepatitis or due to inflammation, they will further cause cirrhosis. What is cirrhosis? Cirrhosis is nothing but it is a fibrous scar tissue, fibrous scar formation, simply fibrous scar formation. And this will continue for 5 to 25 years. Simple. यहाँ पे देखो chronic liver disease में क्या होता, permanent structural changes will be seen and this will be present in the body for many years. Whereas acute liver disease is, it is seen suddenly patient's liver will be failed, and due to that patient sometimes may have complications like hepatic encephalopathy and coagulopathy. And if patient has hepatic encephalopathy and coagulopathy, we have to go with liver transplantation, and patient, if liver transplantation is not done, patient will die. Whereas chronic liver disease में ऐसा नहीं रहता, suddenly it will not develop. In chronic liver disease also complications can be seen. In that also we have complications. We have esophageal varices, we have hepatic encephalopathy, we have ascites, we have coagulopathy. All these complications are also seen in chronic liver disease. Okay, so this is the just basic difference between acute and chronic liver disease. You should understand this. Now let us try to learn some causes for hepatic disease, causes for hepatitis, or causes for liver disease. We have so many causes for liver disease. I think you already know some causes. You have to concentrate here, everybody. See, first very very important cause for liver disease is viral infection. आप लोग सुने होंगे viral infections. If anybody has viral infection on hepatic tissue, they are called viral hepatitis. In that we have hepatitis A, which is caused due to hepatitis virus A. उसका virus का नाम ही है hepatitis A virus. I'll not go in detail about all these viruses and their clinical presentations. I'm just enlisting the causes. About these we'll discuss in some other classes, but today's topic we'll discuss only about cholangitis. Okay, anyways, देखो, hepatitis A, we have hepatitis B, we have hepatitis C, we have hepatitis D, and also hepatitis E. These are different types of viruses. Each virus has their own morphological features and their clinical presentations are different, and their route of infection is also different. ये सब आप लोग already pathophysiology में पढ़े होंगे. This is first cause, viral infection. Viral infection is first cause. Next, this is first. Next, patient will have hepatic disease due to alcohol. Very very important and very very common. Alcohol, very very common cause. Alcoholic hepatitis, alcoholic liver disease करके we might have seen in the SSG hospital. In general department, if you go, you will find many cases. Now third cause, we have drugs. We have so many drugs that causes hepatitis or hepatic failure or hepatic disease. Especially we have paracetamol. We have some antimicrobial agents. In antimicrobial agents, we have antitubercular drugs, antifungals, antivirals. We have NSAIDs, chronic use of NSAIDs. NSAIDs can also cause. We have anti-cancer drugs, anti-neoplastic drugs. All these drugs, chronic use करने से it may cause hepatic disease. Okay. Anyways, we'll not go in detail about all this. Next, fourth cause, we have autoimmune disorders. Very very important. Autoimmune disorders. Okay, autoimmune disorder is the fourth cause. And fifth, we have some other causes. We have vascular disorders. We have some blood vessel disorders. They are called vascular abnormalities. Vascular abnormalities also can cause hepatitis. याद रख लेना. And we have some other causes. We have some metabolic disorders. Metabolic disorders में you might have heard there is a very very important condition while explaining about iron deficiency anemia, I explained you hemochromatosis. सुने नाम? hema hemochromatosis hemochromatosis is one cause in metabolic disorders. Hemochromatosis. We have Wilson's disease. Wilson's disease. Copper accumulation हो जाता करके I told. Okay. Wilson's disease. We have alpha 1 antitrypsin deficiency. Antitrypsin. What is trypsin? Trypsin is a proteolytic enzyme. Antitrypsin means it inhibits trypsin. Alpha 1 antitrypsin deficiency is one cause. Actually this antitrypsin is very important. Alpha 1 antitrypsin bolte. This will protect most of the tissues in the body, especially liver. If patient has this deficiency, alpha 1 antitrypsin deficiency, liver will be damaged due to trypsin activity. Okay. And we have glycogen storage disease. Disease का नाम ही है glycogen storage disease. And we have one more condition called Gilbert's syndrome. Gilbert's syndrome. Gilbert's syndrome. All these are different causes for hepatitis. Just try to remember these names. We will discuss about each drug in detail in some other classes. At least you should know the causes of hepatic disease. So in today's class, let us try to discuss in detail about autoimmune or immune disorders. Do you know in autoimmune disorders we have some other types. In autoimmune disorders which will cause hepatic disease. Autoimmune diseases which will cause hepatic disease. In that we have, remember all these things, autoimmune hepatitis. Disease का नाम ही है autoimmune hepatitis. In short we call it as autoimmune hepatitis, AIH. Second autoimmune disorder which causes hepatitis is primary biliary cirrhosis. अपन जो केस देखे थे ना, this is the actual condition we have to discuss because our case is mainly depend on this. Okay, so primary biliary cirrhosis comes under autoimmune disorders of hepatic diseases. Just to give you clarity, I'm explaining all these things. And we have another type of autoimmune disease which is called primary sclerosing cholangitis. Primary biliary cirrhosis is also called primary biliary cholangitis. Anyway, chalo, I think you all understood the different causes of hepatic disease. In that we will discuss about primary biliary cirrhosis. Okay, now let me tell you some important points about primary biliary cirrhosis. ये याद रख लो, primary biliary cirrhosis कहीं भी आए ना तो you should try to remember, which is called PBC. Okay, now I will try to explain you about PBC. Are you all following me, everybody? Primary biliary cirrhosis. Okay, we are discussing about this condition now. याद रख लो सब लोग, very first important point in primary biliary cirrhosis. First very important point, this condition is autoimmune. Okay, autoimmune, ये चीज पता है अपने को already. And primary biliary cirrhosis commonly affects women. Very important point. 95% of cases with primary biliary cirrhosis occurs in women. Women are mainly affected with PBC. First important point. Second important point, this primary biliary cirrhosis occurs especially in middle-aged women. Middle-aged women means not aged ones and not young ones. Middle-aged means it occurs between 30 to 60 years of age. I am not telling all this. This epidemiological data is explaining all these things. Okay, in epidemiology we found only this. First of all, primary biliary cirrhosis, it is an autoimmune disorder. It occurs mainly women and also it occurs mainly in middle-aged women. Important point. And now you see, this primary biliary cirrhosis is mainly characterized by, याद रख लो, it is mainly characterized by the presence of anti-mitochondrial याद रख लो, एंटी माइटोकॉन्ड्रियल एंटीबॉडीज. See, this primary biliary cirrhosis is mainly characterized by presence of anti-mitochondrial antibody, and it is mainly characterized by destruction of interlobular ducts. You know what are interlobular ducts? It destroys interlobular ducts. Just imagine this is a liver. In liver is mainly divided into two side, I mean left and right tissues. We have left and right biliary canaliculi, and this left and right biliary canaliculi are attached by many interlobular ducts. All the interlobular ducts will join together and they will associate to the right and left biliary canaliculi, and they will associate as bile duct. Okay, and this bile duct will come and join to the cystic duct, and with this cystic duct will directly come and join as it will come out as common bile duct. ये सब already anatomy में अपन पढ़े. So inside we have so many interlobular ducts. All the interlobular ducts are damaged, and this interlobular duct damage is seen particularly in primary biliary cirrhosis, because primary biliary cirrhosis is characterized by destruction of interlobular ducts, and it is also characterized by presence of anti-mitochondrial antibody. If a patient has anti-mitochondrial antibody and destruction of interlobular ducts, that condition is especially seen in primary biliary cirrhosis. Primary biliary cirrhosis diagnose करने के लिए क्या चाहिए? Ducts damage होनी चाहिए, and it should present with anti-mitochondrial antibody. Clear? And now there is one condition called ductopenia. Ductopenia is nothing but destruction of ducts or absence of ducts. Here this condition, this autoimmune anti-mitochondrial antibodies are destroying the interlobular ducts, and due to that, what it is causing? It is causing ductopenia, and this ductopenia further leads to accumulation of fats and accumulation of all toxic substances in the liver. Because ducts are absent, it will not, the excretory waste products are not entered into the hepatic duct, and it will not be transported into the duodenum. Okay, so this is very important point you have to remember. Now you see, you understood what is primary biliary cirrhosis. It is an autoimmune disorder. Some autoantibodies are located in the liver, and these autoantibodies will destroy the tissue in the tissue, especially ducts. It will destroy ducts. These important points we have seen, and it is commonly seen in women, and 95% of them are affected, especially in women. All these things we know. Now you see, now let me explain the clinical presentations or signs and symptoms of any chronic liver disease. Chronic liver disease जो भी है, it may be alcoholic chronic liver disease, or it may be drug induced liver disease, or maybe autoimmune liver disease, or it may be any liver disease. In any of the liver disease, patient will have some signs and symptoms, because all these signs and symptoms you must know. This is just for extra knowledge purpose I'm telling, because at the end we'll discuss the case. Now you see, I will try to explain each and every clinical presentation in detail. See, first clinical presentation, these are early, we can say early clinical presentations. These are early clinical presentations, and these are, we can say these as complications or late complications or late. Here already they have written end stage findings करके है. See, initially what we can see, we can find patient with jaundice. Why jaundice? Jaundice is nothing but the elevated bilirubin in the blood, because here due to liver failure, due to chronic liver disease, the excretion of bilirubin is not seen properly. So what happens? The bilirubin tries to accumulate in the liver as well as in the blood, so it causes jaundice. It's very simple. And patient will have gynecomastia. And loss of body hair, especially in males. In males, patient will have loss of hair. This is usually caused due to the elevated estrogen levels. Actually estrogen levels which are produced in the males are metabolized by liver. Liver metabolize नहीं करेगा तो क्या होगा? All these female hormones will be increased, and due to that, what happens? Patient will develop gynecomastia, development of breast in the males, and loss of hair can be seen. And there are some hand changes. On the palm patient will have erythema, and on the fingers we will find clubbing, and we have Dupuytren's contracture and leukonychia. Just try to see here, everybody. See, this is pulmonar erythema. You can zoom out, you can zoom and you can see. This is pulmonar erythema, and this is clubbing. It's clubbing. Spoon shaped nails हो जाते. Okay, so we have Dupuytren's contracture. This is Dupuytren's contracture. This one, it is here. Dupuytren's contracture. Fingers morphology will be changed. Fingers पूरे turn हो जाते, उल्टा पुल्टा हो जाते. I mean the fingers are not in their right position. Okay, and this one is leukonychia. Leukonychia is nothing but change in the color of the nail. Nail के ऊपर discoloration आ जाते. That is leukonychia. And this enlargement of parotid gland. We have salivary glands, right? Parotid gland enlarge हो जाते. This is one. And this is spider type rashes can be seen, which is called spider navy. Spider navy bolte. Okay. Spider navy. Scratch marks on the skin. Rashes can be seen. Parotid enlargement. Purpura can be seen. Splenomegaly. Spleen size will be increased. Testicular atrophy. Testis size decreases. Xanthelasma. Xanthelasma is very important. Xanthelasma. Suno. Xanthelasma is accumulation of cholesterol, yellowish tissue, accumulation of cholesterol around the eyelids or on the eyelids. Eyelid के ऊपर, eyes के आजू बाजू में क्या होगा? Accumulation of cholesterol can be seen. This is called xanthelasma. याद रख लो. Why this is seen? You know, for every clinical presentation we have reason. Pulmonary erythema is due to the absence of clotting factors, because liver is manufacturing or it is synthesizing clotting factors. Due to the absence of clotting factors, what happens? Inside the body, bleeding occurs. Wherever bleeding occurs, wherever clotting decreases, we will find erythema. On the palm, if patient has this kind of erythema, we have to understand that patient is having bleeding risk. Okay, patient will have clubbing. All these clubbing can be seen in anemia conditions also. Okay, so all these symptoms are mainly seen with liver dysfunction. Okay, and we have some end stage findings here. What we left? Yes, patient will have hair loss, that we have already seen. Xanthelasma is accumulation of fats, and patient will have ascites. Ascites is accumulation of fluid in the abdominal cavity. This is one complication actually. Iske mechanism also we have, and we have dilated abdominal blood vessels. Blood vessels on the abdominal cavity will be dilated, and patient will have fetor hepaticus. Fetor hepaticus is a condition where patient will smell or patient will exhale bad smell. When patient exhales, patient will have bad smell. Okay, and hepatic flap bolte. Hepatic flap is due to encephalopathy. Patient's hands and fingers will not be in right position. I mean, see in this image I have this one. Hepatic flap bolte isko. If anybody tries to stretch their hands, and if they move these fingers, they can't move properly. They can't move their arms upside and downwards due to motor changes. Motor nerve changes होने के कारण what happens? They will be shivering, they will be tremors can be seen. So stretching is not properly seen. Okay, so that is also due to hepatic disease. Due to hepatic disease, that condition is called hepatic flap. Okay, and some neurological changes can be seen. Hepatic encephalopathy. This is another complication. I think you already know what is hepatic encephalopathy. How many of you know about hepatic encephalopathy? Yes or no? Tell me fast. Shivani, do you know what is hepatic encephalopathy? Yes. So hepatic encephalopathy. Actually, hepatic encephalopathy में क्या होता है? Due to liver failure, when liver is failed, liver actually it metabolizes urea. It metabolizes ammonia. Sorry, it metabolizes ammonia into urea. But in hepatic failure, what happens? Ammonia is not metabolized into urea, so ammonia elevates. This ammonia goes into brain, and in the brain it accumulates and it produces encephalopathy, or it damages the brain layers, encephalon. That is called hepatic encephalopathy. Liver fail होने के कारण brain will be destroyed or brain tissues will be destroyed. That is called hepatic encephalopathy. And disorientation, भगते रहता patient इधर उधर, patient can't stand properly. This is called disorientation. Changes in consciousness, same. Disorientation, consciousness. एक बार hepatic encephalopathy अगर ज़्यादा हो गया तो patient will go to coma also. That is the last stage. Actually in hepatic encephalopathy we have 4 to 5 stages. So coma में चले जाता. And peripheral edema can be seen, pigmental changes on the skin can be seen, muscle wasting can be seen. All these things can be seen in hepatic encephalopathy. These are the different signs and symptoms of chronic liver disease. I think you have already learned these things. I'm just revising. Okay. Now you see, let us try to find the answer for the case. You understood what is acute kidney injury? you understood what is acute liver disease, you understood what is chronic liver disease definitions, you understood causes, different causes of liver disease. In that we have seen about immune disorders. In that particularly we have seen primary biliary cirrhosis. Okay, about this condition we have seen. Now you see the case, we will go back to the case. Before that, see, already the case, in that case what happened, patient was already diagnosed with primary biliary cirrhosis, and this is commonly seen in females. That point also we already know. Due to this, patient sometimes may have hepatic encephalopathy, patient also may have ascites, patient may also have other complications like coagulopathy. Coagulopathy is nothing but abnormal coagulation or bleeding disorder. These are different complications we can see if patient has primary biliary cirrhosis, right? And along with this, particularly patient will have what? Patient will have interlobular damage, interlobular duct damage. That is called ductopenia. Penia. So these are common clinical presentations and complications we can see in primary biliary cirrhosis. See, we will go to the case. Patient had all this, and now the main complaint of the patient is severe back pain. What is the main reason for severe back pain for this patient who is already diagnosed with primary biliary cirrhosis is the first question. Now let us try to find the answer for this. Severe back pain is caused in hepatic disease patients में back pain होता क्या? Yes. See, in this patient, first reason for severe back pain is hepatic disease. Second reason for her back pain is patient is aged. Aged means patient had over 50 years. If patient's age is over 50 years, what will happen? Patient is at menopause. And menopausal patients will not have female sexual hormones, especially estrogens. And due to the absence of estrogens in females, patient will have osteoporosis. First reason for severe back pain is hepatic disease. Second reason for her severe back pain is menopause. See, for first reason, why hepatic disease will cause back pain is because hepatic disease is important in maintaining calcium level and maintaining vitamin D. In first slide itself, I explained you the functions. So, in hepatic disease, calcium is not maintained due to deficiency of vitamin D because vitamin D is activated by liver. So here, due to deficiency of vitamin D and due to deficiency of calcium, patient had osteoporosis, first reason. And in that case, if this is seen, the osteoporosis mainly in the spine bones, okay, we can see destruction or we can see osteoporosis. Due to that, patient had severe back pain. And second reason is patient has menopause. Menopause में तो osteoporosis होएगा. Not only back pain, patient will have other joint pains also. Patient will have bone fractures also. Patient will have risk of other body pains also. So here patient is only having back pain because patient is having two aggravating factors. Number one is hepatic disease and number two is menopause. So this is the two reasons for her back pain. Now give the treatment for patient who is having severe back pain due to primary biliary cirrhosis. See, for treatment of primary biliary cirrhosis, याद रख लो, blind answer. Only effective treatment for primary biliary cirrhosis is liver transplantation. Very, very important point. Let me repeat the point. The only effective treatment, not only treatment, only effective treatment. Only effective treatment for primary biliary cirrhosis is liver transplantation. But for liver transplantation, we should need the donor, and with the donor, so there are so many parameters we have to fulfill. So for that, it is not that easy to go liver transplantation. Anyways, before liver transplantation, we can give or we can save the patient or we can manage the patient's condition with some drugs. In that, the only drug or the only condition, only drug that can manage the liver condition is UDCA, which is called ursodeoxycholic acid tablets. I think you might have heard this UDCA in hospitals में liver failure cases में any liver failure patients UDCA is very commonly prescribed because UDCA contains all the liver related enzymes and factors, and through that we can decrease the patient's signs and symptoms. We can manage the patient's signs and symptoms for a few days. Okay, so UDCA can be given. And especially this case, patient was having severe back pain, no? Severe back pain. For severe back pain, what we have to go? We can go with calcium plus vitamin D. We can go with calcium plus vitamin D. We can go with some NSAIDs. We can go with NSAIDs. And along with this, we can also go with hormone replacement therapy. याद रख लो, because patient is at menopause. We have two reasons. Number one is disease, primary biliary cirrhosis, and number two is patient is at menopause. So hormone replacement therapy can help in this case. In our case, hormone replacement therapy can be given. NSAIDs can be given to decrease the pain. Calcium, vitamin D supplements can be given. अब देखो, most of the clinical pharmacists and most of the physicians, what they do, if patient has severe pain, they will choose opioid analgesics. But here याद रख लो, if anybody has body pain due to liver injury or due to liver disease, never prescribe opioid analgesics. Can anyone give me the reason why we should not go with opioid analgesics in liver disease patients? Anybody from the class? मेटाबॉलिज्म नहीं होगा, ये पैरासिटामॉल भी नहीं होगा, हार्मोन्स भी नहीं होंगे, विटामिन भी नहीं होगा, कैल्शियम भी नहीं होगा. I mean, we have one reason. Main reason for not going with opioid analgesic is opioids are centrally acting drugs. They are centrally acting sedatives or centrally acting analgesics, right? Opioids will aggravate hepatic encephalopathy symptoms. Already patient is liver failed patient में hepatic encephalopathy होने के chances है, yes or no? Risk है. Already hepatic encephalopathy में we have stages, stage 0, stage 1, stage 2, depend on the concentration of ammonia in the body. Depend on concentration. Already hepatic disease है तो patient में ammonia concentration बढ़ के रहेगा, and hepatic encephalopathy होने के chances already we have. If opioid analgesic is given, hepatic encephalopathy symptoms will be aggravated. So patient coma में जाने के chances ज़्यादा है. We have more chances of aggravating hepatic encephalopathy symptoms. That's why we should avoid opioid analgesics in hepatic disease conditions, in this condition. Okay, so we have two questions. In the case patient was having severe back pain, what is the reason? The reason be understood, and for that what treatment options do we have? We can go with calcium vitamin D treatment, we can go with NSAIDs, low dose NSAIDs, we can go with hormone replacement therapy, and along with that we can go और क्या बच्चा, yes, we can go with UDCA, but avoid opioid analgesics. And if patient has hepatic encephalopathy and other hepatic complications, the main effective treatment is liver transplantation. Liver transplantation is the only treatment of choice in this case. Clear everybody? इसमें कुछ डाउट है तो पूछो फटाफट. I'll give you the answers.